It was a diagnosis Debbie Bell says caught her completely off guard.
Was a shock. It's like when I first went into the ER, they started saying, well, it could be heart related.
She says she never really had any symptoms up until returning from a trip to California earlier this year.
Suddenly I started not feeling well. Within a few days, I was having trouble breathing.
Debbie went to her doctor, who then sent her to the emergency room. And after some rounds of testing, within about 5 days, doctors knew exactly what it was: stage 4 ovarian cancer.
When they told me, it was really hard. My mom and my dad have both had cancer, so, I've kind of seen what they went through.
She's already had several rounds of chemo and will have more in the future. But the treatment that she and thousands of others suffering from cancer are receiving is being affected by a nationwide shortage of medication used to treat the disease, specifically carboplatin and cisplatin, caused in part by a manufacturing plant that was shut down in India due to quality issues, along with a shortage of raw materials.
The carboplatin or the cisplatin is the standard of care.
Dr. Robin Zahn is president of ASCO, the American Society of Clinical Oncology based near Washington, D.C., representing more than 45,000 physicians and other healthcare professionals who care for people with cancer. She says for patients receiving the drugs, modifying their chemotherapy schedule is usually the first option.
Instead of a timing of every 3 weeks, maybe it'll be every 4 weeks, just because we're trying to buy time and hope that there's an increase in production and availability of these generic medications.
Somebody who's in a more advanced stage of cancer, does even trying to buy time by just an extra week, like you mentioned, does that affect their treatment because their cancer might be so advanced?
The answer is it depends on the cancer.
Debbie's doctors aren't reducing her 3-week frequency because she's considered frontline, but they will substitute the carboplatin she receives with another drug.
And there are not that many options available for ovarian cancer patients. So it's really important that you can get the one that the doctor's prescribing from you.
ASCO says drug shortages have been happening for well over a decade. More recently, the organization issued a 5-page statement in May to a U.S. House committee examining the root causes of drug shortages, along with recommendations to mitigate them. But the fight inside the halls of Congress on how to prevent a shortage is nothing new either. In 2019, U.S. Senator Susan Collins of Maine introduced bipartisan legislation that would have required the U.S. Food and Drug Administration to prioritize life-saving or life-sustaining drugs that are facing shortages. The bill never made it out of committee. Key provisions of that bill, however, were enacted into the CARES Act.
We, as healthcare systems and providers, need to have much better communication about exactly what the drug supply is and not finding out the weekend before shipment, because we need to plan, for the patients to turn a chair time, getting approval from their payers and so on.
Debbie also taking matters into her own hands by increasing awareness in cancer support Facebook groups, along with writing state and federal lawmakers, including Senator Todd Young. His office says he has heard from constituents about the shortage and that there are ongoing discussions about possible legislative proposals, but doesn't have an update on a specific bill. President Biden also touting a renewed priority on cancer in September of last year.
Beating cancer is something we can do together.
Calling for an increase in research funding in the next fiscal year budget. According to an FDA database that tracks drug shortages, about 24 chemotherapy drugs were in an active shortage status as of the end of March of this year. The FDA has taken more immediate steps to ease the most recent shortage by allowing a temporary import of an unapproved Chinese cancer drug, which the FDA says is safe. Dr. Zahn says that in the future, the drug market could be better stabilized with long-term contracts, adding that it's difficult for a drug maker to manufacture generic drugs and still support its processes because of the less expensive cost compared to brand name ones.
But similarly, then, the payers have to be willing to pay a little bit more, not a lot, just a little bit more for the generic drugs versus the name brand drugs. So they're both short-term and long-term fixes.
As for Debbie and thousands of other cancer patients, the shortage is just another stressor when so much is already on the line.
I want to live, and I want to spend more time with friends and family and do whatever God has in mind for me. And, it's just really hits hard.
I'm John Paul. Thanks for watching. Please take a moment to subscribe to our channel and follow today's top stories by downloading the WSBT 22 News app.